Good morning. And my case report is of the Tetralogy of fallot. Okay, we start showing the filters and that says and the article. Okay, and the abstract newborn female, age 7 days, uh, RH positive, and spontaneous vertex delivery, rupture of intrapartum membranes, circulagnic take, cyanosis from birth, receive resuscitation, um, admitted to the UC, and that to persistent of cyanosis and receive ventilation and the inotropic report without improvement in clinical status. Persistent 7 77 and 18% in saturation. Um, Refer the other health institution for pretty a cardiographic diagnostic and cyanosis, heart disease, and pulmonary hypertension. The results of the chest and radiography, mild cardiomegaly, and atelectasis plus and caesuritis in the right hemithorax, and the cardiographic results, the tetralogy of followed with an absence of pulmonary sigmoids and transfers to and to other intensive care unit with a pediatric heart surgeon, and cardiopediatric refers to an aortic ejection murmur. The tetralogy of followed with a moderate pulmonary stenosis. Um, does does not warrant surgical treatment. The and the pharmacological treatment is recommended, and the control of restricted fluids, ventilation support plus early extubation. And he develops rash and basal pneumonia, um, and severe respiratory acidosis, kidney failure, moderate pulmonary hypertension. Makes a cardiorespiratory arrest. Okay, add okay the introduction, and and okay, and makes a cardiology respiratory arrest, and the newborn uh, death, and enter to legal medicine. The necropsia result, it's a generalized cyanosis, and the heart of the newborn is 20 grains, and the heart with a dilated right atrium, patent foraminal wall, absence of sigmoid valves in the pulmonary artery, hypertrophy of the right ventricle, interventricular foramen at the level of the infundibule, um, 1 by 0.7 centimeters, um, and right in right atrium, which is seen on the Tetralogy of fallot. And the introduction, it's the main case of cyanotic hair disease with a high mortality is a Tetralogy of fallot. Sometimes is susceptible to the surgical treatment, and in this case it's a 7-day-old newborn with a said malformation, absence of pulmonary valves, who died for of cardiorespiratory arrest due to due that to the severity of the pathology. Okay, the diagnostic is a congenital hair malformation compatible with a tetralogy of fallot and absence of pulmonary sigmoid valves. Okay, the discussion. Um, okay, these pictures. And the number one, aortic truss over interventricular septum, and the number two, patency of the foramen wall, interventricular communication. And okay, the followed disease has an insight of zero point 0.1 in the thousand in live births, and it's responsible for the 10% of congenital hair disease. It's also the most common case of cyanotic of cardiac origin at birth, and the etiology is unknown, but it's subject that it's of multifactorial progeny. Um, by its name Tetralogy, we can understand that are four anomalies. Number one, it's obstruction of blood flow out of the right ventricle, and the number two, it's large ventricle septum defect, and the number three, it's the aortic artery rides over the UB is day, and the number four, hypertrophy of the right ventricle, and this is a severe obstruction in the pulmonary artery for the which an increase in right ventricular pressure occurs, um, which will lead to the passage of desoxy- desoxygenated blood to the left ventricle that will add disturbance of the systemic circulation, to the aorta, and result in cyanosis. Um, the symptoms on the tetralogy of Fallot are directly linked to the severity of subpulmonary stenosis and the presence of the pulmonary valve atresia. Okay, the treatment is the first, it's pharmacological of support with beta blocker, and depending on the case, we can operate. This surgery consists of close the interventricular defect and correcting the pulmonary stenosis. Okay, in the mortality of the tetralogy of Fallot, it's um, patients with a pharmacological treatment is it's 25 percent. And okay, the conclusion, Fallot dogs has a poor prognosis due to its severe malformation, and that cause severe pulmonary hypertension and completely to manage heart failure. Okay, in this case, a report, the patient was diagnosed with a tetralogy of Fallot and an absence of the pulmonary sigmoid valves. And yeah, and discuss uh, that stands out the signs. It show the pathology of tetralogy of Fallot. It's rare, and even more so is the associated with absence of pulmonary sigmoid valves. Since the combination represents only 3% of all cases of the tetralogy of Fallot. And thank you. That's it. And have a good day, teacher.